Hi everyone, welcome to my channel. Today we're going to be talking about emergency codes in a hospital setting. I live in California. I want to discuss what my codes mean. However, for your codes, it may mean something else. So send me a comment below. I'd be happy to hear about what's your experience. My name is Christina Velasco, nurse practitioner. Let's get started. So code triage is an external disaster that occurs from outside of the hospital. That's when an influx of patients are coming in. So we will get text pages from the hospital that there is a disaster occurring. That's when hundreds of nurses and doctors are coming in and respiratory therapists to help assist with the disaster that's going on, which kind of sounds familiar with the current pandemic that we're going through right now. Moving on to the next one. Code silver. Code silver for us means a person has a weapon or a bomb. Something we don't want to happen in a hospital. Code red is fire. If it's not within your area or your unit, we typically will close all the doors, make sure we don't smell anything, make sure everyone is safe. In the event, if we need to evacuate, the hospital would call a code green. That's when we would evacuate the patient. Code gray is your abusive or combative person. That's usually like the emergency department, and it can also happen during change of shift. I usually notice that when families stray to the waiting room and there tends to be more conflict. It's not a nice situation. Code blue. This is the code where kind of everyone pauses when you hear code and then you hear code blue. Everyone runs, especially if it's in your area. They go into the rooms, they flood the rooms with the respiratory therapists. It can be nurses, doctors. I mean, everyone is in there. It's great. It's powerful. This is typically for someone that comes in that has a pulmonary or cardiac arrest, or your patient just went south. So you need help and you need help now. That's code blue. Then you have code orange. Code orange is a hazardous spill. So it's a chemical spill. You have policies and procedures set up to help to contain that. It hasn't happened to me, but it's something that you need to know about and just know where your policy and guidelines are. And code pink is an infant abduction. Labor and delivery across the world, they have definitely tightened up their security. I hope I never hear that code, but if so, we know how to make sure we provide excellent care to where we look to see where and if there is a baby indeed abducted. Same for code purple, which is a child abduction, which I hope I never hear while I'm in the hospital. Again, thank you so much. Make sure you hit that like button, subscribe for upcoming notifications. Thank you.